to the Dr. Oz Show. It's the weight training maneuver you hear about most, the valsalva. Its effectiveness is legendary, however its dangerous side effects are equally as infamous. Today, we'll get to the bottom of the valsalva maneuver, the athlete's secret weapon and the physician's nightmare. I'm sharing professional opinions and years of research with you on today's show. Is the valsalva right for you? Wait and find out. So let's look at the objectives of today's show. Number 1, argue for or against using the valsalva maneuver based on the performance and medical evidence presented. And number 2, apply this knowledge in order to decide on the breathing technique you will implement in your own resistance training program. Alrighty audience, time to pull out your clickety-clickers for a quick valsalva pretest. Question number 1. What type of training is the valsalva maneuver most commonly used in? I see. Question number 2. What is the most common danger when using the valsalva maneuver? Okay. Finally, question number 3. What is a known benefit of using the valsalva maneuver in resistance training? Great. Okay. Please welcome our first guest, Jimmy Pipes, who has taken time out of his 12-hour daily workout regime to share his opinions regarding the valsalva.
I'm sexy and I know it.
Hey, Dr. Oz. Welcome, Jimmy Pipes. So generally, we think of the valsalva maneuver as a weight training aid reserved for men with supersized bikes. How exactly do you do it? Well, it's not that difficult. You see, an increase in intra-abdominal pressure by trying to exhale against a closed glottis results in a slight inhibition of right ventricle blood flow. Then once you release the pressure, flow is resumed. Do you want to give it a try? Absolutely. All right, audience, feel free to join in. People at home, I suggest you use a lighter weight. So all we're going to do is some nice easy contractions, breathing normally. Now we're going to try and do the valsalva. So we're going to try and exhale, but we're not going to let any air escape from our mouth or our nose. So like this. Give it a try. Can you just feel that force flowing through those muscles? Oh yes, this must be how the Schwarzenegger does it. Oh yeah, and it's pretty easy to understand too. The sudden breath hold while lifting increases respiratory-related cortical neural functioning, which enhances motor drive to non-respiratory muscles, increasing your maximum force. That's why you see benefits in both skeletal muscle function and structure. Jimmy Pipes, thank you so much for sharing your bulging biceps with our audience today. Any day, Dr. Oz. Next up, please welcome the airy, the fairy, Miss Willow Breeze.
Hello, Dr. Oz.
Please make yourself comfortable.
Thank you.
So, Miss Breeze, where do you stand on the valsalva maneuver?
Well, you see, I personally am a strong believer in the importance of proper breathing to bring more oxygen to your blood and therefore to your brain, and as well to control prana, the vital life force. Since yoga is my personal area of expertise, I consulted the literature to see if the valsalva maneuver really had the resistance training benefits that the previous, and might say guest told us about.
One rationale for using the valsalva during maximal effort would be to increase intra-abdominal and intrathoracic pressure to improve trunk stability and provide additional stiffness to improve muscle force production in the extremities. A study by Higgins and others examined the relationship between voluntary control of breath, intra-abdominal pressure, and maximal trunk extension force. They found that intra-abdominal pressure increased significantly during the valsalva compared to other breathing conditions, but this was not associated with an increased trunk extension force production. A second study by Akita and others found that both the valsalva and a forced exhalation breathing technique increased maximal isometric forces during elbow extension, shoulder adduction, and knee extension, whereas voluntary breathing did not seem to influence the peak force during knee flexion, elbow flexion, and shoulder adduction. So as you can see, the relationship between the valsalva and force output during resistance training may not be as straightforward as some consider it to be.
Whew, that was a little exhausting. What do you say we practice some breathing techniques?
Absolutely.
Everyone, feel free to join in. Wow, I feel better already.
Miss Willow Breeze, thanks for breathing with us today.
Now the problem is nothing like a little oxygen between friends.
Namaste. Welcome back to the show. Please join me in inviting Dr. Scalpel to the stage.
Good morning, Dr. Oz.
And to you, please. So far today, we've heard the training implications of the valsalva maneuver. What is your take on it in the medical sense?
Well, I believe that you should not do the valsalva maneuver. It puts too much strain on your body. As you're doing this maneuver, the interthoracic pressure is increasing in your arteries, and your arteries can take it because they are built to withstand that pressure. However, when the pressure moves down into the arterioles and capillaries, these smaller vessels cannot take that type of pressure and will rupture. For instance, everybody look under your seat. You have a surprise.
Oh, this looks like fun.
Now, pretend this is your artery. As you squeeze it, you can see the pressure that your artery is put under. However, if too much pressure is put on it, it ruptures. That's what me and my seasoned professionals have seen in our day. Burst capillaries in the eyes and in other capillary vents. In addition, studies have shown cerebral syncope. Syncope refers to a loss of consciousness, has been associated with cerebral vasoconstriction in the absence of systemic hypotension. This may occur during the valsalva maneuver. In addition, notable changes in blood flow velocity are involved in compromising the cerebral perfusion pressure. This would not be enjoyable at a 250-pound lift.
Thanks for sharing with us the physiological implications of the valsalva.
But of course, it's my job.
Last but not least, please welcome Dr. Buckingham. Well, hello.
Hello.
So, what medical evidence about the valsalva maneuver do you have to share with us today?
Well, Dr. Oz, this idea of the brief breath hold or brief 2 to 3 second valsalva maneuver has been introduced over 10 years ago, and yet it has been completely ignored in the literature. It seems that those in favor of either regular controlled breathing or, on the other end, the full valsalva maneuver are unwilling to accept the strong evidence that the brief breath hold is not only safe for athletes to perform in the resistance training, but actually protects from damage.
A study done in 2001 looked into the belief that this increased pressure load on left ventricular wall associated with resistance training will alter left ventricular morphology. Their findings were that the hypertensive blood pressure response to the brief breath hold was secondary to increased intrathoracic pressure, which actually acts to protect the heart and prevent alteration in left ventricular systolic function or wall stress.
A second study performed used clinically stable population that had undergone various neurosurgical operations so that the researchers had access to their intracranial measurements. They used a 1 repetition maximum bicep curl to test the effects that this brief breath hold had on the intracranial pressure. They argued that the elevated systolic blood pressure associated with a brief breath hold does not damage cerebral arteries if the intracranial pressure surrounding the arteries also increases.
The important pressure that stresses the cerebral arteries is actually the cerebral vascular transmural pressure. They found that exercise performed without a brief breath hold was associated with an increased intracranial pressure that was less than the change in systolic blood pressure, resulting in an increase in this important cerebrovascular transmural pressure. Conversely, the heightened interthoracic pressure from performing a short valsalva maneuver led to an increase in intracranial pressure occurring with a minimal increase in systolic blood pressure, leading to a decrease in this important pressure. Thus, the heightened intrathoracic pressure that increases intracranial pressure actually acts as a safety mechanism that prevents an increase in cerebrovascular transmural pressure, leading them to conclude that a brief breath hold actually acts to protect the cerebrovascular system.
Dr. Buckingham, thank you so much for sharing your evidence with us today.
Okay, audience, let's thank our experts for coming in today. So what did you learn? Get those clickers ready for the post-test questions. Please press a response for each of the 3 questions. Wow, great job on those responses. Looks like today's show has really brought the secrets of the Valsalva maneuver to light. So after hearing evidence from many different fields of study, what is our final decision about using the Valsalva maneuver? Let's recap today's show. First, the ripped Jimmy Pipes defined the Valsalva for us, as well as taught us how to perform the maneuver. His argument is do the Valsalva for the benefit of increased force capabilities while weightlifting. Willow Breeze, our lovely yoga instructor, described the importance of breathing while exercising, thus arguing against performing the Valsalva maneuver while training. After hearing conflicting views from our trainers, we turned to the medical professionals for evidence based on research studies. Dr. Scalpel informed us of the potential damaging physiological effects of the Valsalva. He used a participation activity to highlight the risk of small artery rupture. Finally, Dr. Buckingham shared evidence arguing that a brief breath hold is safe to perform during resistance training and that it actually balances different pressures in the body, providing protection to the brain while lifting. Although the first 3 guests shared compelling arguments for their respective beliefs, it seems that Dr. Buckingham's argument included evidence that was the most recent and from the highest level.
The final decision stands that a brief breath hold is safe and provides the most gains during weight training. So get out there and start pumping some iron. Remember, a brief breath hold is not only safe, it will also maximize your gains in the gym. See you all next time when we travel through the GI tract to look at the many causes of constipation.